Good morning. Pat Zemer here with MagnaWave. Oh, let me get this started here. I need to do that. Trying something new this morning. Pat Zemer here with MagnaWave. And I'm going to, hold on. All right, here we go. Starting. All right, good morning. Pat Zemer here with MagnaWave. Office hours, we bring it to you every Tuesday morning at this time. We try to make most Tuesday mornings. Once in a while we do run into some issues, but we're here to answer your questions, whatever they may be, regarding MagnaWave PEMF, PEMF devices, our training services, whatever it is that you might like to have questions about with regard to MagnaWave and PEMF. Today we're trying something new, as also we're using an app called Castbox. We'll put a link into the conversation area of the Facebook page, and so you can go to this link, follow it, download the Castbox app, and then you can listen and talk with me on your phone instead of necessarily having to watch it on Facebook or YouTube, wherever we may be. So it's just an opportunity to have a third application, a way to broadcast the program and participate with you and get the information to you that you'd like to have with regard to MagnaWave and PEMF, pulsed electromagnetic field therapy. So that's where we are. I presume that we are broadcasting on the, yes, it is broadcasting on Castbox. And got to see the questions coming in here. Sheila, good morning. How are you? Katrina, that's working. The chat's working from Restream. Things are kind of interesting here, how this is coming together. So if you have a question, just post it into the Facebook chat area, and we'll get that, and I can pursue it from there. Or you can load the Castbox app and use your phone as you're walking around, traveling, doing whatever you're doing, and listen that way, or call in via Castbox and talk with us. You can also send us a text at 502-599-9722, and I will call you back. The neat thing about this Castbox is there can be up to 4 or 5 different people calling and be on the conversation at the same time. We may get a test of that here in a little bit, but we're able to do that. So we could have the way I plan on using this is maybe have Dr. Marty call in and then be able to take questions from our listeners and viewers at that time, and then have a conversation accordingly. So we're kind of excited about being able to expand our horizons and be able to deal with more folks and answer the questions that you're looking for. We did receive a question the other day from Robin, talking about she was treating a horse that's owned by a veterinarian. And so she treated the neck and the whole body of the horse, and after the treatment, within a day or two after the treatment, the horse developed some whelps or hives on its neck. And the doctor became very concerned that the hives were caused by the heat put off from the device, and the question became, can this device cause heating of the tissue that would cause these whelps to occur? And now they just occurred on the neck. They didn't occur anywhere else as she did the top line or the hips or the shoulders or anything like that, just in the area of the neck. And so the doctor was asking that question. And the answer to that question is, and again, we've been doing this for almost 20 years at this point, and heat has never been an issue, heating of the tissue, because of the intermittent signal. The signals fire in nanosecond bursts of energy, so it's not a continual signal like an MRI that could cause something to heat up, could heat the tissue. In this case, with nanobursts of energy, you don't have that capability of having a heat buildup that would fuse the tissue and cause this kind of action to develop. Typically, when you see something like that, there's a pre-existing situation there already. Maybe the horse was having something coming on that was going to come on, and by utilizing the MagnaWave, it simply showed up a little earlier than it would typically be the situation. Or there's something going on with the horse that with what's happening, all of a sudden these show up. But again, if it was heating tissue and causing this to happen, it would happen throughout the body, not just on the neck. It would happen on the legs, it would happen on the top line or whatever. So quite often there are other circumstances involved that people need to look at, but certainly it's a place to start. Well, we just treated this horse. This is what we saw within a day or two after the treatment. Did your treatment facilitate this coming along? And typically, no, it does not, because it does not produce heat in that type of situation like that. And we have that when we're doing rods and screws and things like that have been implanted in the body, knee replacements, hips, that type of situation. If the devices caused heat, then it would be uncomfortable to use in those situations, and it is not. We always check, and we always want to be certain that the client is comfortable receiving the energy into their body and not feeling what they would think would be warmth or heat or anything like that. So it has not been an issue over the years when someone has a metal implant in their body to be able to receive this soothing energy into the body to help relieve pain and promote wellness, good oxygenation, and blood flow. So that's kind of the situation there with that question. It was a very good question, and I will certainly respond to her and get her that answer in a more of a typewritten form so they can understand it and follow through with it. If you have any questions, just simply drop them into the chat box, and I'd be happy to have a look and answer them for you. Let's see, Hazel, thanks for being with us. Janet's with us. Nancy's with us this morning, so we're glad. If one of you might want to go and download the CastBox app and open it up, and you'll see when you open it up the live programs that are on, and I think you can do it without even you don't have to sign up for anything. It's a free service that's available for you to listen. The programs will also be there for replay if you wanted to listen to it like a podcast in your car as you're driving somewhere. So the CastBox feature will be available for that also. We're also going to create a CastBox channel that will be private just for our practitioners, to where we can have a talk show, if you will, or a conversation. We plan on doing conversations about marketing, where we can bring a guest on, discuss the marketing, answer your questions, different ways to develop your business and build your business, conversations again with doctors and practitioners in a more private area that you can go a little deeper with your questions that you may not go if you're talking here with me today or seeing how this gone. Rick has joined. Rick, thanks for being with us. This is a conversation about MagnaWave PEMF, Rick, and how it is utilized for health and wellness in the United States and countries around the world. Good morning, Maureen. Thank you for being here. Coming along good. Got a question?
Yeah, Katina did ask, she's interested in info on our training program here at MagnaWave.
Pardon me?
She's interested in our training.
Oh, our training program, the certification program that we have at MagnaWave. It is a full-blown certification program. We have training for humans, small animals, and for large animals, being horses and cattle, so forth. And certainly people do treat show pigs. They treat all forms of animals. But the training is broken down into, again, human, small animal, and large animal. The training consists of videos and a series of quizzes or tests that go along with each section of the training, so a person can come in and just do the human aspect of the training, and then or they could do all three portions of the training, which again is video driven. We have question and answer type of situations within the training. We do have once someone receives our training, the certification is good for 2 years, so they're on the same page as everyone else in the conversations, and at that point, after 2 years, they can extend their certification with some additional training or continuing education that's available. And certainly the situation becomes that you can use this group that you're part of as far as the training. You go into the MagnaWave Certified Practitioners group, where you can go in and ask those people what type of questions you may have with regard to your practitioners and the services that you're providing. So we have a total complement of support and training that you can utilize as part of the MagnaWave training and certification process. Great question. Thank you for answering. Any other questions out there at this point that you can see? Looks like everything is kind of quiet. A few people have joined us on the Castbox app. For those of you that are there, this is a program presented by MagnaWave, PEMF.com, for the utilization of answering questions from practitioners and people in general who want to know more about this type of health and wellness aspect and how it is utilized for individual health and wellness pain relief for folks that are experiencing that. Any other questions that you see there, Chris, this morning?
Not yet.
Okay, let me take a look here in the practitioner. Let me go to the certified practitioner page and see if we've had some questions there that potentially I could have a look at. Has anyone successfully treated ulcers in a horse? One person asks. Well, certainly by improving the blood oxygenation in the body, that's beneficial for the ulcers and where the wounds are in the body to help that situation along, so you can help basically enhance the healing process of ulcers. Basically, just to be a little more succinct with that, the device, as you know, helps the individual cells of the body uptake or take on more oxygen so they can be healthier to better do their job. And good oxygenated cells, as they move through the body, fight inflammation, help situations heal more rapidly, and provide basically a well-being to the body, or a sense of well-being, allowing the body to better heal itself. So any indication that a person may have that can be helped with good oxygenated blood and improved blood flow, our device can help support that healing process again, so the body can better heal itself in that type of situation. Another question was wondering if MagnaWave can help with really bad anxiety. Recently asked if it would help even a few days after a treatment is over. And the answer to that question is yes. Typically, what happens and what we've learned over the years with this type of device, or utilizing PEMF or MagnaWave PEMF, that when you treat a full body, you have a sense of well-being. A person would say, gee, I feel relaxed, or I have a good sense of well-being, a feeling of that. An animal, you can tell they may not be as fidgety. They may be just more relaxed as they move in their, if it's a small animal at home or a horse in their stall. We often treat what we call the pole, or the head of the animal, head and neck. It's called the Oshiro principle, where you start at the top of the head and move down the spine or down the back of a horse or an animal, and it is very relaxing to the animals. If you can relax them, you can relieve some anxiety just with the sense of well-being. An animal feels that just as much as a person will feel that type of feeling after receiving this type of treatment. So yes, it can be very beneficial when dealing with anxiety, depression. We don't think of our animals as being depressed, but they can be, fearful and just not sure of what's going on or what's happening. And so that can be that type of situation. So we just like to make sure that everything is good from that perspective. Okay, let's see. It looks like we're having a microphone problem. Everything's good. All right. So if you have any questions, just drop them into the chat box, and I'd be happy to have a look at them. Appreciate the folks that are with us this morning. Being with us each Tuesday is fun, and we enjoy answering those questions for you. Those of you in Castbox who are with us that may be new to hearing about what we're doing, if you got any questions, I'd be happy to answer yours as well. Okay, let's see. Thank you for the large way. Let's see if we've got any other questions here that people may have asked. Friend's daughter was bitten by a copperhead the other night. She spent the night in the hospital and received 2 doses of anti-venom. Her foot is pretty swollen. Is it safe to MagnaWave? She was thinking lower power with the semi time, and she would appreciate the advice or thoughts with that. Well, certainly once they've administered the anti-venom, which will basically kill off the bad parts of the venom, if you will, neutralize the potential poisoning, you want to make sure that's done, because we don't want to do anything to spread the venom through the system. This is a situation you would certainly ask the doctor, how long does it take the anti-venom to neutralize and make it that the venom is not going to be dangerous to the patient or the client. Once that is established, if the doctor says it happens within 12 hours or it happens immediately as it circulates through the blood, then you would be safe to then pursue utilizing the MagnaWave to relieve the inflammation and to help heal the area where the bite occurred. So that's the basic premise here. Ask the doctor, make sure you get the clarification on the application of the anti-venom, and then utilize the machine with air clearance, certainly, once the anti-venom has taken effect, and then you can deal with the inflammation. The fact that the venom is there or the bite occurred, that's where the inflammation comes from, in the immediate area. Of course, again, the anti-venom goes into that area also and helps keep everything at bay. But most certainly, it could be beneficial for any type of inflammation in the body that you want to see taken care of or helped. We do have a question here. Any advice on treating radial nerve paralysis? Been working with the entire body, front legs for 2 days with attention to the nerve. We are very concerned about him foundering. He's 27. Okay, so we're talking about a horse, and we're talking about nerve paralysis, and basically the advice is to treat as often as possible to the area. Paralysis is a tricky thing. It depends how advanced, how long, how much it's progressing, if it is progressing in the area of the injury or the indication. And so 2 days is fine, but it's probably a situation that you're going to need to stay with as often as possible. What is that? Is that once a week? Is that every day? Whatever the owner of the horse can allow you to do, and whatever's best. You can't hardly overdo it. So to go after and work on the area and to help take care of it, it is certainly beneficial to the situation. The paralysis is tough because once it's there, it's very difficult to reverse, but certainly treat as often and as much as possible to treat the whole body, to get good blood flow throughout the body, and then the area of concern certainly, and you want to do around the area of concern as well. Don't just do the one spot that you're dealing with. Maybe do up and down or around the area that you're dealing with. Let us know how it continues to go, and that all things may work out for you at that point. Okay, any other questions? Oh, here we go, another questions. How long do we need to wait before treating a torn, ruptured tendon on a horse? Well, this same thing would apply to a horse, a small animal, or a person. Once you sustain the injury, in many of these situations, the more rapidly you can get to the injury, the better off you are. In the case of a tendon like that or something like that, if it's severed or it's torn and it's not going to, be exacerbated by anything, start treating. We want to get the oxygen to the area. We want good blood flow to the area so the body can again begin to better heal itself. It's nothing like a bone where we try to wait 10 to 14 days so the healing process begins in the proper fashion, and then we enhance the healing process with the application of MagnaWave PEMF therapy to the area. When it comes to a torn tendon or something like that, go as quickly as you can. I would treat as often as possible. Now again, sometimes you don't get the luxury of treating a person or a dog once a day or twice a day every day, but as often as you can will provide benefit to the body. And that was kind of the question that was asked a little earlier. How long with the anxiety? How long can it last? In many cases, it can last 24 to 48 hours. If you calm everything down, you relax the person, you relax the animal, things can be better. Same thing here. If you treat this animal and you treat the area where the tear is, and you treat the full body, you've got the next 15, 16, 24 hours of good oxygenated blood moving through the body before it begins to deteriorate back to where it was for whatever reason. That's toxicity, environment, a lot of things add to that type situation. But it can last for a period of time. So typically, if you treat today, you still got very good effects and very good results being accumulated for the next 24, even 48 hours in that type of treatment situation. But in that type of situation, I would begin treating immediately, and I would treat as often as possible for that type of issue that you're dealing with. Great questions. If you have any other questions, just put them in the chat box. I'd be more than happy to take a look at them as you present them up there. Let's see if there's anything else coming up here that I'm not seeing. Okay. Well, we're working pretty good on the, got 21, 25 people on the Facebook. I don't know how we're doing on the YouTube, but we got some folks on there as well. And there are some people listening on the Castbox. I don't know if they're just listening because they're new to the issue. Castbox is a type of type of program where it shows all the people broadcasting live at any particular moment. So someone can come in and listen to a show on health and wellness, listen to a show just being general talk, on news, politics, health and wellness, whatever it may be, just many different topics of programs, much like tuning through your regular radio station dial on your car or wherever you may be. Let's see, there's a question. I've been working with a horse with anhidrosis for 2 or 3 days and have done whole body once. And let's see, once and twice just focused on the chest, neck, girth, back, but haven't seen any sign of a sweat. Okay, certainly there is a system to working with the anhidrosis and how and when you want to apply that. And basically you're going to treat the neck and chest of the horse, and you're going to then move into a full body type of treatment. Again, trying to get a good blood flow situation, good oxygenation to the area, and then hopefully allowing the horse to develop more normal, natural sweating patterns. If it's still not there, I would say, let's see, where are you? 2 or 3 days. It may take a little more than that, but I'll tell you what I would suggest is that you call the office and talk with Erin and give her more specifics as to what you're dealing with here, and then she can give you more of a direct protocol potentially for the animal that you're dealing with, because there are a lot of variables: where you are, time of day, those types of things. Do you have good ventilation in the stall? Even though you may think, well, I don't need good ventilation because I want the horse to start sweating without ventilation. There's a lot of different factors that come into play there that you do want to address as you approach this type of situation. So anhidrosis is a tough one when horses don't sweat the way they're supposed to, because sweating will help keep them cool, keep them comfortable as they're moving and going through their operations that you want them to do and to accomplish on a day-to-day basis with the horses. Okay. Let's see, I followed the protocol and used my semi-5 on medium. I really want to see the horse sweat again. I wanted some input if you think they may need to change my approach. Thank you. I would say you can maybe boost what you're doing as far as the setting. If you're using it on the medium setting, if you want to go up to a higher setting on the semi-5 to get more deep penetration into the area, if you have the paddle, I would use the paddle on the neck and the chest area and the shoulders of the horse, again, to get a little more intensity, a little more depth down into the tissue. That's what happens. It goes all the way through, but the setting determines the amount of energy that's transferred into the body. So what I'm looking at here with your question is, as long as the horse is comfortable and you can go up to the 5 setting or the 4 setting on the device, I think you might find or be the result that you're looking for. Also, you could utilize the Wave wings if you have the wings, and come over the shoulders and the chest area also, so you're getting in the good area of the lungs, so you're getting that whole type of area approached. Good questions. Hi, Sandy, for joining us. Sandy said hello. So there you go with that. Good question with the anhidrosis. If you have any other questions, simply put them in the chat box on Facebook, YouTube. And they'll come up here on my screen for me, or if you're with us on Castbox, that would be fine as well to be able to talk back and forth if you would like to do that. Let's see. What is your experience with abscesses? I'm having trouble understanding their reactions to the MagnaWave. Emmy, very good question. Our experience with abscesses is that basically if you take abscesses in horses is what they're talking about here for those of you who may be new to this program today. Basically what happens is we want to improve the circulation, we want to improve the oxygen to the foot of the animal to help move that abscess along so it pops or comes out more rapidly. Abscesses can be very troubling. They can last for days or longer periods of time, be very uncomfortable. Horses can't stand properly. It can cause additional problems because of how they're standing, pressure that puts on the other foot or the other leg. A lot of things can develop from that, so we want to try to clear that abscess as rapidly as possible. The basic protocol is to use the paddle with the box. You can put the hoof right on the box and paddle. You can raise up the hoof, so the horse is standing on 3 legs. Put the paddle on the bottom of the foot or the butterfly loop on the bottom of the foot and turn the machine as high as the horse is comfortable or the horse will allow you to do. And that can mean that if you turn it pretty high, if you're holding that hoof up, for example, it could be moving in your hand because of the energy going in, causing the foot and the leg to move a little bit. On the box, you won't see that because they're putting their pressure right on the box. But turn it up. If it's too much for them, they won't stand on the box. They will step off of the box if you're using that. But the theory is to apply as much energy to the area for 8 to 10 minutes, let's say, as possible. Now, if you're using a semi or the Semi 5 or the Semi 3 machine, you might want that process may be more of a 15 to 30 minute treatment because you don't have as much power or intensity with the Semi devices that you do have with the Pulse Pro or the you'd run the Soul a little longer also. But with the Pulse Pro or the Max devices or the Maya, you can turn those devices up. They have much more energy coming out, and you only need the 8 to 10 minutes, maybe 12 minutes on that area to treat it. So the reactions are, again, if you're holding the foot up, you're going to see movement as the device pulses. If you're on the pad, you're not going to see that so much. But with the treatment, typically we found that after just a few treatments, many cases 1 or 2 treatments, the abscess can release, and then we can get about the healing process of the area. Richard says hello on Castbox. Hello, Richard. And he asked, are we there? Yes, we are here. This is the first time we've utilized the Castbox app, Richard, so we may be a little new in what we're trying to figure out to do here, but we are here. Oh, let's see. No, let's see. I thought maybe I had my microphone off, but obviously, can you hear me, Richard? Just give me a thing there if you can't hear anything. I don't know why you can't hear. Let me do a quick look here. How about now? Can you hear me now, Richard? If you can hear, let's see. Just give me a high sign that you might be able to hear me. It looks like I've got the microphone muted at this point. You know what? Let me do this. Turn off the hearing aids and maybe it'll work better on Castbox. We're learning every day. Try this now. How's that? Will that make any difference, Richard? Are you able to hear me now on the Castbox app? We're just learning. We're trying to make sure we do it properly. Any other questions? Let's see. Can MagnaWave, let's see. Any suggestion for treating a person with bad allergies and difficulty breathing? They already use a nebulizer, but looking for other alternatives without having to go to shots and more meds. Okay, certainly if you can improve the blood oxygenation in the body, then that can go some ways for help clearing up the sinuses in the head. You could treat the head specifically if you have a lot of congestion in the head itself. Are we going to eliminate an allergy? That's hard to say. Can we lessen the symptoms of the allergy, allowing the body to better be in a position to deal with the allergy? Most certainly. But specifically to say, I've got this allergy, I'm going to use this, what we want to do is utilize it to help the overall health of the body to be there, so things typically improve. But certainly what happens if they're using a nebulizer to try to clear the head and the lungs, to freshen the lungs, to treat the lungs, to give them good oxygenation, good blood flow in the lungs. They may better receive the medication that's being applied with the nebulizer, if there is medication. Sometimes we just nebulize to get just good flow through the lungs, get it going. But if they are applying a medication with the nebulizer, what that does is puts little droplets of the medication into the system that go to the lungs that can better penetrate the lungs. Well, we've had this with people with COPD and different lung conditions. If you can keep everything flowing freely through the lungs, then it will be more receptive to the medications or to whatever is being utilized with the nebulizer. So again, using this type of therapy in conjunction with the nebulizer or other things they're doing can enhance what they're doing that could keep them from needing more medication. For example, we at the MagnaCon, we had speakers that were talking about Parkinson's disease and the amount of medication that is required when someone suffers from Parkinson's. And what we've experienced is people who utilize our therapy are able to go longer, to use less medication, and to hopefully, which causes issues on its own. If you use a lot of medication, how it affects the body and what you're doing may not be a side effect that you want. So it can be beneficial when you're dealing with difficulty breathing and allergies, that type of situation. Okay, let's see, we have another one. I meant under skin, Emmy was talking about, abscesses. She was talking about abscesses under skin, not in the hoof. Same thing. If you've got an abscess somewhere and you treat the area, what you're doing is you're pulsing into the area where you have this module of pus, whatever it may be, there, and you want to just massage it, flow it, get the body to help relieve it. Most certainly treat that area much like you would be talking about treating inflammation or something like that. There have been cases, and talk about growth on the skin or in the body, where you have a tumor type of thing. We've found, and it's been shown, that utilizing PEMF can reduce those situations, can reduce the size of tumors, making them more vulnerable to whatever medication may be applied to help kill the tumor or do whatever you want to do, move it away, take it away, whatever the situation may be. So now you won't see it if you got an abscess somewhere and you're going to treat it. You're not going to see it react like I was talking about the abscess on the hoof of a horse, or even an animal or a person. So you want to treat the area, and it's also good to treat the whole body, so the body receives to that area good oxygenated blood over the series of several hours or over a period of time. Great question. Thank you, Emmy, for bringing that up and clearing that up. So we put, my group put some more information up there about MagnaWave PEMF and allergies and how it can be utilized. Any other questions? Just put them in the chat box here, and again, we'd be happy to answer. Kyle, did we get one? I don't see it. Is it at the top?
Can MagnaWave be used to improve results when flushing donor cows in terms of embryo averages?
I see that. Okay. Can MagnaWave be used to improve results when flushing donor cows in terms of embryo averages? Well, we've done a lot of work over the years when you talk about reproductive situations and that whole thing, and we found that there are some good results. Again, just kind of think this through a little bit. If a good standardized body, if the body's in a good position to do what it's supposed to do, it can be very beneficial to those types of situations. So to treat the area of development and so forth can certainly be good and something that you might want to look at. Now, there's a whole point in time where we're talking about, conception and all of that when you would stop and when you would not go forward. But a good question, but it could be utilized to improve results when flushing donor cows. Certainly something to look at, discuss with your vet, develop a protocol. You might want to call the office and talk with Erin, and she can give you some basis on that to help you down that road a little further with that type of questions. Let's see, good morning from Germany. That's cool. Do you have devices, the CE sticker by now? Greetings. Do our devices have the CE sticker? I've been out of the office for the last week because of a death in the family, and so I had not had a chance to further talk with our folks in California, but what they had done, just so you understand, we have CE approval. Our factory, our devices have passed all the criteria with regard to U.S. safety testing, with regard to the factory certification in the factory passing the inspections necessary to be a facility that can manufacture CE approved devices. We've passed all of that. We were just waiting for the results from the company that inspected the factory to make sure that the factory was up to the standards that they want for CE approvals. And what happened was that company that inspected our factory and several other factories submitted the wrong type of form to the CE regulatory boards, and they were all kicked back. And it was several of them. And the last I spoke with the factory, which would have been a week ago Friday or Thursday, the company that did the inspections had cleared up their reporting and had resubmitted new reports on all of the companies that they inspected to the CE regulatory boards, and we're looking for and waiting for the response from that at this time. When that happens, if you have a device that is CE approved, we will be able to, at that time, send you the sticker to apply to the device, as any new devices that go out will have the stickers already affixed from the factory. But if someone has a device that is part of our CE approval, which would be the Maya device, the Semi machine, the Vesta Dual is not yet through safety testing, but it will be applied as well once it completes its safety testing. So it would be the Maya and the Semi devices that would be CE cleared at this point once we get the final letter back from the factory inspection. And again, that process should be very close to being achieved at this point. To that end, to bring us up to speed a little bit on the FDA processes, we have applied for and completed everything for 5 different areas of 510K predicate approval for the devices, and that can take place very quickly. Plus, we have our 3 studies that are taking place now at the University of Miami, Henry Ford Hospital in Detroit, and the Palm Beach VA clinic in the Los Angeles area, dealing with various indications, so we can get more specific as we apply for other approvals from the FDA at that point. So that's an update on both of those. Very good question. John, do you know what we can say with CE, or will that come after? Well, that's a good question. As a practitioner in the United States, let's say you can still talk about, you'll be able to talk, John, specifically that it is a medical CE approved device. And what you can talk about from the healing capabilities, or how a doctor would talk about it differently than an individual would talk about it, probably is the same in Europe as it is here in the United States. So a practitioner who is not a doctor would approach it from the standpoint of its capabilities to promote healing. It has been known to help with these particular areas, and it is approved as a medical device. You kind of marry all of that together. In the U.S., as an individual, if a device is approved for a specific area of treatment, you can say that this device is used for depression, or this device is used for glioblastoma brain tumors, and our device is similar to that, and so that's how it goes on. It never hurts to err on the side of caution when you're describing things and talking about things. What you can't do, no matter where you are, if you're not a doctor, is you can't diagnose, and you don't want to diagnose. So you want to always be very careful in what you say with regard to talking about a diagnosis. What something is said to help and how it can help are always pretty safe, and how you can approach something. The difference is when you have something, what people over the years, and I've worked with since 2002 with many different devices and many different things, and so people, when they say, well, is it FDA approved, they're asking that question just to make sure that it's safe and that there are some background to it, that there is some study to it, that there is some science to what's going on. A lot of times people ask that question because that's a way of saying, I don't know. Is it FDA cleared? Well, we're working on it. Well, when it's FDA cleared, talk to me. In the meantime, let me have my back pain or whatever it may be, dealing with that type of situation. So erring on the side of caution will always be a good situation, but what people are going to want to know in Europe is CE medical type of device that is cleared for human use, and that's our interest, is to have a device that can be up until over the years. If we wanted to have a device go to Europe or Canada or wherever it may go, it would go as a veterinary device, because the typical needs and rules for veterinary use are different than that for human. And so a lot of times we couldn't sell devices for human use because we did not have everything in place. CE, safety tests, all that takes time, costs a lot of money to put all of that in place. I will tell you that MagnaWave, our sister manufacturer and sister companies that we deal with around the country that are in our little consortium, if you will, are some of the only companies that have done safety testing, that are working to get FDA clearance for specific areas, and are working to have CE approval in the European or other countries that recognize the CE designation as opposed to the FDA or whatever situation it may be. So I hope that's a little clearer. And again, today's my first day back for about almost 2 weeks because of this illness and situation in the family. So I will get back on that today as we move forward and have more information for you as we go forward. So great questions. Thank you. Can we work with people, good question, with a magnet implanted? This does not pull a magnet. So in other words, if you had a piece of metal on the table and you use this coil, it's not going to pick that piece of metal up and attach it to the coil. It's not going to do anything like that. So can you use it around magnets? Yes, there is no adverse situation to that. Now, what is the magnet for? What's it implanted for? Is it part of a device that's implanted, a pacemaker or something like that? I don't really know that. Perhaps, Hazel, you could give me a little more information as to why the magnet is there and what it's there for, what it's doing, and certainly asking the doctor what that may be would be something that you would want to pursue. But it's not going to pull it. People used to ask the question, I've got a metal implant, you're going to put this in, is it going to unscrew the screw or is it going to loosen the rod? No. It doesn't do that. It does not attract like a magnet. All it's doing is putting a magnetic energy field into the body at that point to help the area that you're dealing with. So Hazel, I wouldn't see an issue, but I'm not the doctor and I don't know exactly why it is there. So I would pursue those questions also, but again, it's not going to attract a magnet and cause it to be removed or changed. You've seen it in the television or in the movies where they put somebody in an MRI chamber and they've got this piece of metal in their body and all of a sudden it tries to come out of the body, because that's a different situation in an MRI, what it does and how it approaches the body. So, but this is not that. We're intermittent bursts of energy, nanosecond bursts of energy that puts this energy into the body, stimulates the area, allowing the area to be in a better situation to hopefully better heal itself. Okay, let's see. There are a few sites here now selling these machines and making claims that I've been bitten once simply because I mentioned drug-free pain relief on my site. That's interesting to say drug-free pain relief. Need to think that one through a little bit.
England.
Yeah, and it could be the situation in England as to what you can say. Probably the Association of Drug-Free and Pain Relief to say drugless pain relief is different than drug-free, a little bit, but I just talk pain relief. And if someone asks you that question, then you can take them on down that road as to better answer that question. Because you don't want to put something in print. And I'll tell you, we've been very cautious over the years when we talk about things that we don't want to claim something as fact. And so there were times when people would ask me questions, why don't you put this in writing on the website? Well, if I write it down on the website and I fully describe what we're trying to do and to bring to the table in a non-diagnostic manner, someone could still look at that and say, wow, you're going pretty deep into this. I think you're talking about healing something, and we're not doing that. We don't talk about healing anything. We simply talk about producing a situation in the body to allow the body to be in a better position to do its job and heal itself. So it's if there's a question on the words, don't use them. Use something else. Let someone ask you a question, and then you can answer it in a one-on-one environment much easier and in a more friendly type of situation. Good, John, you're welcome. I just completed a certification process and how eager to start my MagnaWave is. Good. Deborah, thanks for joining us. Thanks for writing and let us know what's going on and what you're doing. Magnet to adjust. Okay, so Hazel lets me know the magnet is there to adjust the flow of a stent. So the question becomes there, was this programmed? Is this stent computer programmed, computer monitored, that the magnet is there as part of that situation? And so you have, and I will tell you that there have been times when there have been stents to where I've never heard of a magnet, but to where they are programmed, and we don't want to do anything to alter that program and change the action of the blood flowing through that stent in the body. So this is really a question for the doc as to why the magnet's there. Can we, because it could be a problem if someone, and people have had this happen, they go somewhere and they do something, and not with us necessarily, but they go and all of a sudden this stent that they have becomes deprogrammed, and now they got to go in and have a whole process administered that's probably not comfortable or really not easy or time consuming or whatever the situation may be, that we don't want to have happen. So that's the question. When you said magnetic operation of a stent, how's it powered? What's causing the magnet to do its job? We don't want to do anything. The reason to put this, that we don't want to do anything that would change the power source, that would alter the programming that this magnet is being used for. And that's the situation when you talk about defibrillators or pacemakers. We don't want, well, what would happen typically, it wouldn't set a pacemaker off or a defibrillator off, but it could cause the battery, just by virtue of the magnetic field, to weaken more rapidly than it's supposed to. And so that's why we don't treat around pacemakers and defibrillators for that particular purpose. Now, new pacemakers that are made, there have been many doctors, because of the way they're made, with two poles or how the power is delivered, we've been told that if someone has a pacemaker, you can treat as long as you're a foot away from the pacemaker, which would mean if the pacemaker's here, could you treat my low back? Could you treat my hips? Could you treat my knees and feet? Most certainly. So you can approach it in that area. Can you treat my shoulder? Probably not, because the pacemaker's right here, my shoulder's here. And so there are a lot of different situations that come in there. However, that's also a conversation for the doctor. If they realize that the pacemaker itself will not be disturbed by various application, it could also be the power that you're administering to the area, that maybe you could still treat someone's back of their head for a headache or for discomfort or for anxiety or depression at a very low setting and not interfere with the device as you go forward. So that's what I would do. And Hazel, you do need to just figure out what the situation is as far as what's powering the flow of that stent. There are some people that have joined us on the Castbox app, and again, if someone would like to part of our group, click the link, go to the CastBox app, load it up, and come join us. That would be great, because we'd love to talk with you on the app. Today's the first time we've used it, and we do want to just kind of learn with it and see how to proceed with that. Time is about up. If you have any additional questions, please put them up at this point, and I'd be happy to answer those questions. Here's a question that is on the group, Facebook practitioner group. Do these machines only go for a certain amount of hours? I see people that are selling them used, mentioning how many hours they have on them. No, that they're not limited to a number of hours. I have seen devices to where there is a device that we looked at a couple of weeks ago. Someone brought to our attention that you would take this little pod, if you will, and you'd attach it. You'd put this thing on your shoulder, you'd attach the pod to it, and you'd use it for 24 hours or 48 hours. Once that's depleted, you'd throw it away and put a new one on, which can become quite costly. Those little pods ran anywhere from $35 to $85 per pod, and so that could really mount up cost-wise. But with our devices, there's no certain amount of clicks, no certain amount of hours or anything that are on them. People talk about the number of hours, just letting you know how much the device was used. And so if it's got 500 hours on it and it's 5 years old, it's been used 100 hours a year, which is not bad at all. If it had 5 years old and had 5,000 hours on it, does that mean that it's not working properly? No. Does that mean that it can't operate for another 5 years? No. It just means that it's got that many hours on it. That would say that it's been in and out, up and down, used a lot. Might it need to be refurbed more rapidly? Yes. So people talk about hours in terms of how long and how much their machine has been used. Much like boats. You go look at a boat, how many hours are on the boat? Has it been in the water running? Well, it's been in so many hours, and the boat's this, it's kind of like mileage on a car. Boats don't have mileage, so they have hours. And so how many miles are on the car, how many hours are on the boat? Same thing on our devices, how many hours are on the device. They're simply doing that to give you a better indication of how much it's been used over the period of time that the machine has been in place. I would say that it's not unusual for a machine. There are people that put thousands hours on a machine in a year. There are people that will put several hundred hours on a device in a year. And typically, depending how you're using it, there is a point to where the machine needs to be maybe recalibrated or brought all the parts into best operating position, and that can be anywhere from 500 to 800 to 1,000 hours, which is a lot of use when you talk about the number of treatments that are applied. If a treatment was a 20-minute treatment, if you will, 1,000 hours can be 3,000 treatments. So that's a lot of treatments when you figure you can only treat 10 horses in a day, or or 10 people in a day, whatever it is. So that's a lot of treatment and a lot of time. I hope that answers the question with regard to the utilizing the hours on the machine. Any other questions, simply put them in there. We'd be happy to answer them. Let's see. I have to look up Reserpine. He got the med today, was planning MW tomorrow. Typically, with most medications that are administered, what we like to do, if they're going to administer a medication today, we want it to become metabolized. So wait till tomorrow is a good situation in that case. It's metabolized. It's where they want it to be. It's doing what it's going to do. Can you enhance what's going on with good blood flow and good blood oxygenation? Most certainly. And so that's the way to approach that. Would I administer a medication now and treat it in 15 minutes? No, I'd again let the medication be established into the body, and that's the same for people as well, and small animals. Let things become assimilated in the body, then you simply treat the body to enhance what can happen with those types of healing processes and the situation. Hope that answers that question. Elaine just came into the room. Good morning.
Good morning.
Any other questions that you may have, simply put them in the cast box. I'd be happy to do that, or into YouTube or Facebook, and I'd be happy to answer those questions. We are pretty much out of time for today. There have been some very good questions. I appreciate you watching or listening, whatever the case may be, and we appreciate being here. Again, we'll be back next week to address whatever questions that you may have to help you with your MagnaWave business, with your utilization for your own health and well-being. So, I'm Pat Zemer from MagnaWave. I appreciate you being here. I look forward to have a great Magna Wellness Week ahead for you, and we'll talk to you next week. Have a great day.